Thank you all for being here. I'm Mario Moreno Cepeda. I'm the Chief of Staff at ONDCP. We're going to get started with the ceremonial swearing in of Dr. Rahul Gupta. And we'll start with an invocation from Reverend Dr. Christopher Zacharias, who's a senior pastor at the John Wesley AME Zion Church here in Washington, D.C. And we're really honored to have him here to kick us off with the invocation. Reverend?
Good afternoon, my sisters and brothers. Would you bow your heads for a moment of prayer? To the creator of the universe that has us gathered in our own spiritual expression of faith, to provide a spiritual covering upon the swearing-in ceremony of Dr. Gupta. Thank you for granting us all this opportunity to bear witness of your historical move and blessings upon his life, the life of his family, and our country. May your presence of peace, promise, and prosperity be upon us throughout this ceremony and in the labor of love of Dr. Gupta's dedicated responsibility of leadership. We trust and believe through him and his team, policies will be set, implemented for the good of humankind and in honor of you. May this ceremony reflect the celebration of Dr. Gupta and the confirmation of the wonderful work that will be done. Thank you for granting us this day, this ceremony, in honor of all the spiritual expressions of faith. Amen.
Please come on in. Great. Thank you. Thank you, Reverend. Hello, everybody. My name is Mario Moreno, as I said. I'm the Chief of Staff at ONDCP. Thank you, Reverend, for grounding us in the bigger purpose of today, because although we're celebrating the ceremonial swearing in of Dr. Gupta, we're doing so in the shadow of yesterday's heart-wrenching data release. 100,000 Americans died from an overdose from April 2020 to April 2021. So as we work through today, let's keep that in our minds front and center. Let me start by thanking all of you for being here today with us. I think it's inspiring that in this difficult moment for our nation on overdoses, so many friendly faces, including advocates, interagency partners, and White House staff, have gathered for this event. And it's not just those of us here in this room gathering, but also the dozens, if not hundreds, of advocates and friends of ONDCP who are joining us via live stream on YouTube. Specifically, I want to recognize the presence of several people here. Certainly the Reverend Dr. Christopher Zacharias, who we just met. Senator Joe Manchin and his wife Gail are with us. They've both been in the trenches with ONDCP and with Dr. Gupta, fighting to reduce overdoses in Appalachia and across the nation. The DEA Administrator, Ann Milgram, is here as well. I've enjoyed working with her team over the last couple of months, and I'm looking forward to ongoing collaboration in the coming years as well. Bishop Latrell Easterling, the leader of the Baltimore-Washington Conference, is here as well, and will be delivering the benediction at the end of the event. I also want to welcome Dr. Gupta's wife, Seema, as well as the friends and family he has invited here today. I think I speak for all of ONDCP when I say we're so glad to welcome them by extension into the ONDCP family. Thank you for being here. And last but not least, I want to welcome Regina Lobel, ONDCP's intrepid former acting director, who led our agency in the first 10 months of this administration. Thank you, Regina, for your leadership, for your service, and most of all, for your friendship. So all of us are here today for the ceremonial swearing in of the recently confirmed Director of National Drug Control Policy, Dr. Rahul Gupta. I've had the chance to get to know Dr. Gupta over the last year. Alongside Regina, the three of us worked on the Biden-Harris transition team and mapped out the vision for how this administration was going to address the overdose and addiction epidemic in this country. We worked closely together through his confirmation process, alongside Senator Joe Manchin and other partners in Congress and advocates across the country. And we've worked closely over the last 3 weeks as he has onboarded at ONDCP, traveled to Mexico and the U.S. southern border in only his second week on the job, and led a whole of government response to the news of 100,000 overdoses in just his third week on the job. He has also begun to lay out his vision for drug policy under this administration. He has hit the ground running and has not had a moment's rest since he onboarded. My apologies, Seema. You'll all have a chance to hear his vision later this afternoon, but I'll preview what I'm most excited about. Number one, I'm excited about the overarching focus that he has on real-time data and making sure that data and evidence drive every decision that we make in drug policy in this government. I'm excited about his background as the first physician to lead ONDCP and how that will inform a robust public health approach to reducing overdoses. I'm excited at how his work at the state level modeled how public safety and public health can work together to reduce overdoses and not work at odds with each other. But most of all, I'm excited at his insistence that ONDCP use every ounce of its authority, both inscribed in statute and not, to lead a whole-of-government response to reduce overdoses and save lives. Now, it is my privilege to introduce for remarks and for administering the oath the senior United States Senator from West Virginia and a longtime champion in the work to reduce overdoses and save lives, Senator Joe Manchin.
It's so good to be with all of you today on this tremendous occasion. And for my wife, Gail Manchin, who has been appointed by the President as the co-chair of the Appalachian Regional Commission, something she's dedicated her life to. And so we do know Appalachia very, very well. And to Audrey Smith, Audrey is my policy advisor and does a tremendous job. And she's in tune every day. I'm proud that yet another West Virginian is being sworn in to serve the American people through this administration. Very proud of that. And I have no doubt that Dr. Gupta, a dear friend of mine for many, many years, is going to be a dedicated Office of National Director of Control Policy, Drug Policy. It's just unbelievable what goes on. I've seen firsthand. I mean, I grew up in the coal fields, born and raised in Farmington, West Virginia, a little coal mining town, about 400 people, and seen the ravage, devastation of what this addiction. The one thing about addiction, it's bipartisan. It truly is bipartisan. Doesn't care whether you're Democrat or Republican or independent. It attacks family. Doesn't care whether you're rich or poor. Doesn't segregate. Doesn't pick and choose. It attacks every individual. And I've said this: there's not a person, when I talk in a room such as this, that not one of us in here doesn't know someone in our immediate family, extended family, or close friend that there's not someone who's been affected by addiction of some sort. It is of proportions that we've never seen. And where we go today and how we do that depends on the leadership we have. And that's what I'm so proud about. I see my friend John. I didn't see John, I'm sorry, but I didn't see you there. We have another West Virginian here. John Unger was a state senator, worked with me when I was governor of the state of West Virginia. He was a state senator from West Virginia. And now he's a magistrate over in the Eastern Panhandle. Just a tremendous person, a tremendous compassionate person. He understands it also. So we get it because we live with it every day. I've always said this: you're a product of your environment. You are who you are by where you were raised, how you were raised, and who raised you. And when you start looking at the type of quality of people that come from where they came from, you can usually tell what they're going to be able to produce and how they're going to lead. Dr. Gupta is surrounded by a highly motivated, supportive family. I think if you haven't, you will meet the boys. And you'll know what I mean by highly motivated. I think that everyone and everything that they talk about Dr. Gupta as the professional that he is, need to know him as a father and the husband that he is. His wonderful wife, Dr. Seema Gupta. Seema, if you would stand up so I know they probably all know you. She currently serves as a physician in the VA and has dedicated her life to public service in America, done a tremendous job. They have two twin boys. Arca and Drew. Now let me explain about Arca and Drew. I've known them since they were little kids, and they were just always very active. But they're both attending Harvard Law School and Harvard Medical School, and they've both completed undergraduate degrees at Yale. So it speaks of the quality of the parents, because That person didn't fall on top of the mountain. When you see a person on top, they didn't fall there. They had to get there. And usually there's people pushing them and pulling them and climbing them, doing whatever thing. But because of the leadership and the parenting of Seema and Raul, it just tells you everything to produce two unbelievable young men that is going to benefit our society and all of us. As a longtime resident of our home state of West Virginia, Dr. Gupta served on the Health Commission of the West Virginia under both a Democrat and Republican governor and led the state's response to the drug epidemic that continues to ravage our state. He was head of the state drug policy control there. I had the honor of working with him when I was governor, and just proportions that we saw what was happening. We have one town in West Virginia. It's called Oceana, West Virginia. They renamed it to Oxiana. If you ever read the articles about it, it's unbelievable. Now, this is in southern West Virginia, the coal fields, and when I was at WVU, my roommate was from that town. It was the most beautiful little town I'd ever been to. They had everything going for it. They really did. And then I went back as an elected official and as governor. I'll never forget, I wanted to go back because I heard so much, and I just couldn't believe what I saw and how it had gotten to that point. So I'd gone to a school, and they had about 300 kids in a junior high school. And I gave a little talk to them and everything. And there was a group of kids that wanted to talk to me. They just wanted to meet with me personally afterwards. And I'm thinking, well, these are 12, 13, 14-year-old kids. I said, sure, I'd love to meet with them. The stories that they related to me was unbelievable. What had happened. One little girl told me that she watched her mommy's boyfriend inject her until she overdosed and died. 12-year-old daughter, 12-year-old girl, watching this. And you're wondering how they're going to make it. So I'm telling you this and leading into it. As horrific as their stories were, they brought to me. 4 years later, as they got ready to graduate from high school, every one of the kids were clean. Every one of the kids were productive and going on to college. Every one of them. Because of the trauma they had gone through. But then the town kind of encompassed them. And that's what we do. That's what all of us do. That's what you do every day, all of you. It's basically, I've said this, a lot of us are born as privileged children. Now, you would think as a privileged child, Gail knows what I'm going to say, and John knows what I'm going to say, but you think you're born in a big, fancy home or a big, fancy neighborhood. And you're not. In West Virginia, you're born basically like most, and you live in neighborhoods like coal mining towns, and you live between the tracks and the creek, a 3-room or 4-room garage apartment, and you think everything's just hunky-dory. And they said, why in the world do you think you were privileged? Because I had unconditional love. If you had unconditional love in your life, growing up, no matter what you did, there was someone there for you. No matter how bad you messed up, you had unconditional love that was there to correct you and lead you on again. You're privileged. You really were. More so than those with the material goods. Well, today we don't see that because our families are falling apart. We're trying to put that back together. We're trying to hold it together, and that's a big challenge we all have. If we don't win this war, God help us all. And that's where Dr. Gupta comes in. As a primary care physician, he intimately understands the needs of communities. He's been on the front line, and I mean truly on the front line. He's the one that mentored me, and we talked about it, and I understood how we were supposed to basically treat. He basically explained to me that, Joe, this is, it's an illness, and an illness and a sickness needs treatment. A lot of us in public life, at first, when we heard about this in the 80s and 90s, it was a choice. It was a choice a person made. And we had no pity. So we were locking people up right and left. We were throwing away the key. It was awful what we did because we didn't have any knowledge. And then to have Dr. Gupta come in and explain to us, this is what's happening. And bring the science to it. We understood it, and we had to treat it differently than what we were treating it. We did that. He did that. As Commissioner of the West Virginia Bureau of Public Health, Dr. Gupta saw firsthand the devastation that opiate epidemic did. And he decided to tackle that drug epidemic. He took it head on. His work leading efforts to combat drug epidemic in the state and one of the worst overdose rates in the nation makes him well prepared to lead, truly lead, similar efforts on a national scale. When we lost more than 100,000 Americans in this last year alone, and the hands-on experience makes him an excellent. You're not going to rattle him. You're not going to get him all fired up and excited. That's not Dr. Gupta. If you want someone to solve a problem, that's Dr. Gupta. That's what you're going to get. So, as a dedicated public servant and has served West Virginia admirably, now it's my chance to say congratulations to the United States of America, to having an individual such as Dr. Gupta that's going to bring his desire, his dedication, his commitment, and his professionalism for all of us to be able to understand, be able to help our fellow citizens, no matter where they may be, but also to be able to lift us up. So Dr. Gupta, it is my honor at this time to be able to administer your oath of office. Now, I know my good friend, Senator Unger, would love to do this. John, why don't you come do it with me? John, I can't, this is the most beautiful person I've ever met in public service, is John Unger. And John still serves in so many capacities. He's also a licensed minister. You come right over here with me, John. We'll do this. Dr. Gupta, if you'll raise your right hand. I, your name,
Rahul Gupta,
do solemnly swear
do solemnly swear
that I will support and defend the Constitution of the United States
that I will solemnly support and defend the Constitution of the United States
against all enemies, foreign and domestic,
against all enemies, foreign and domestic,
that I will bear truth, faith, and allegiance to the same,
that I will bear
Bear.
true faith and allegiance to the same,
that I take the obligation freely,
that I take the obligation freely
without any mental reservation
without any mental reservation
or purpose of evasion,
or purpose of evasion,
and I will well and faithfully discharge
and that I will well and faithfully discharge
the duties of the office
the duties of the office
on which I am about to enter.
of which I am about to enter.
So help me God.
So help me God.
Congratulations.
Thank you.
Congratulations. I present to you the new director.
Good afternoon. And welcome to the White House. First of all, I want to thank you to Reverend Dr. Christopher Zacharias for performing the invocation. I also want to thank you, my good friends, Senator Joe Manchin of West Virginia and Mrs. Gail Manchin. Thank you. Thank you for swearing me into the office today. Thank you to my chief of staff, Mario Moreno, for the kind words. And believe me, if I've had unrest, it's because of Mario. I blame him entirely for it. But really, his hard work and leadership, day in and day out, is remarkable and admirable. I also want to thank Regina LaBelle, who's here today with us. He's leading the office in the first months of this administration and putting the agency on the right foot. The entire ONDCP team wishes her well on her return to the academia. I also want to thank you to my colleagues from across the administration, including Secretary of Labor Marty Walsh and DEA Administrator Ann Milgram, for being here today. Thank you. I also want to thank everyone watching online, and thank you for joining. Thank you for all your support, just not today, but throughout the process and for a long time that you have been with me. I also would like to thank my wife, Dr. Seema Gupta, my family, friends gathered here, and my late parents, without whom none of this would be possible. So yesterday, the Centers for Disease Control and Prevention released their latest estimate of overdose deaths. We've heard about that a little bit today. The prediction that we lost more than 100,000 Americans to drug overdose in 12 months, ending in April of 21, is absolutely heartbreaking. Please join me in a moment of silence to recognize the lives lost due to drug overdose during the course of this epidemic. I want to state that the challenge to save lives has never been greater. And as President Biden said yesterday, We will not let up. I am honored that the President has asked me to serve as the Director of National Drug Control Policy and has the confidence in me to meet this challenge. And I'm grateful to the Senate that has confirmed me in a bipartisan manner. A large part goes to Senator Manchin. Under President Biden, our country has made significant progress, and this progress will continue. While I've only been at ONDCP for a short time, my years of practicing medicine and public health, my time in the Biden-Harris transition team, as well as months of preparation between nomination and confirmation, has allowed me to develop a really clear vision of where we need to be heading. As a practicing physician for more than 25 years, I've served in towns as little as 1,900 people to cities as large as 25 million people. What that means is that when I was a health commissioner for West Virginia for 2 governors, I got to see the firsthand the heartbreak that happens behind the overdose epidemic. I learned that every overdose is a cry for help. And for far too many Americans, that cry goes unanswered every minute of every hour of every day. I witnessed the challenges that people, providers, and communities face in responding to this epidemic. And at the same time, I've seen how public safety and public health leaders can work together. They can come together to develop strategies that save lives, and how evidence and data are critical in developing and implementing good policy. And I commit to you that during my tenure, the administration's drug policies will continue to be based on the best evidence and data available to us. We will continue the work underway to expand access to high-quality evidence-based prevention, harm reduction, treatment, and recovery support, while also reducing the supply of harmful substances that are entering our communities. Our work will be centered on supporting the people affected by this epidemic. The victims and their families, that's our true north. And those who currently have substance use disorder, and they need that care. My focus at the beginning will include 4 specific areas that align with the President's drug policy priorities. First, we gotta make sure that naloxone, the drug that reverses overdose from any opioids, including synthetics, is available at every overdose incident. Research shows us that if we increase access to naloxone, we can have the most significant impact on lowering drug overdoses and increasing the quality of life. So I firmly believe that no one should die of an overdose simply because they didn't have access to naloxone. But sadly, today, that's not the case. Across the country, we have problems in a way that oftentimes your zip code defines whether you're gonna live or you're gonna die. To help reduce these deadly disparities, we announced yesterday a new model law for state policymakers to consider that will allow consistent policies around naloxone. Second, we've got to scale up treatment so our capacity meets the ability to treat everybody. We don't have that right now. Today we have too many people that are seeking care and not enough able to access it, not enough providers, and despite the progress we have made in the last decade, we still need more systems, we need infrastructure, we need providers. I just visited the Mary Center in DC today that serves 60,000 people, and they're doing exemplary work with multiple providers. A lot of those are primary care providers, helping and utilizing the benefits of already the policies of not requiring a waiver for up to 30 patients. So that work is happening. Third, we've got to get more timely, actionable data to guide our overdose response strategy. Our policies are based on evidence and data, but as we've seen with COVID, the timeliness and accuracy of results is critical. Right now, we do not have real-time data on overdose epidemic, including instances of overdose and drug trafficking. We're using 20th century tools to fix 21st century problems. And we've got to figure out how to develop those 21st century tools to actually address today's problems. So I'll work closely with our interagency partners to do everything we can to help make informed policy decisions on this issue so we can help save more lives. And lastly, cracking down on illicit finance, which is the root cause of drug trafficking, as much as social determinants are the root cause, oftentimes, of substance use disorder. Drug trafficking organizations, or DTOs as they're called, exploit the financial systems and move illicit profits and support their networks. So we must prioritize dismantling these financial resources in order to weaken their capabilities and disrupt the supply of illicit drugs entering our country. These elements of the Biden-Harris drug policy priorities are critical to reducing the number of overdose deaths as soon as possible, while also strengthening our nation's addiction infrastructure. Now, I recognize that we cannot accomplish this alone. Even the federal government cannot. So our partners in academia are conducting research that helps us improve our approach. Our partners across the executive branch and Congress are key to helping us develop funding resources, implementation, and testing evidence-based policies. Our partners in law enforcement and public health and our first responders are working tirelessly to keep us safe. And our partners in so many communities and constantly those that are pushing to advance policies that will make a difference. I'm gonna say a last few words to people who are watching online today. Ever since I joined the Biden-Harris transition team more than a year ago, I've been really impressed by the exceptional partners across the nation that continue to advocate for change and progress. You have helped ONDCP develop its first-year drug policy priorities, many of which are being in the process of being implemented right now. And a commitment from me to you is that your dedication will continue to be a part of our work moving forward. I approach the overdose epidemic with an extreme sense of urgency, because today, an American is perishing every 5 minutes around the clock. This is unprecedented and unacceptable. So it's up to all of us to help reduce these overdoses and build the addiction infrastructure that our country so desperately needs. I know that you all feel the same sense of urgency. I firmly believe that teamwork, collaboration, and innovation would lead us out of this particular epidemic, and we all have a role to play. So far this year, thanks to your help, the Biden-Harris administration has expanded access to evidence-based treatment, reduced barriers to life-saving harm reduction tools, and provided significant funding for mental and behavioral health. We've also worked closely with partners in Mexico, Colombia, and elsewhere to reduce the supply of illicit drugs. For example, our new agreement with Colombia includes working together to decrease the illicit supply coming into both the United States and in Colombia, while supporting greater security and prosperity in rural areas of Colombia. We hope that Congress will soon take up and pass President Biden's historic drug policy budget request, which includes an unprecedented funding for prevention, treatment, recovery, as well as funding for supply reduction. And it's only to match the unprecedented numbers that we see today as an epidemic. So thank you for making your voices heard of this matter. We have a lot of work ahead to end this epidemic, and I will be working with you all. I just want to say, lastly, as the first physician to lead this office, I know we must build a better addiction infrastructure centered on individuals, families, and bringing communities together. From public health to law enforcement to faith-based organizations and the private sector. so we can meet where people are and save their lives. I said earlier, an overdose is a cry for help. The Biden-Harris administration is working to make sure these cries are heard and answered. As President Biden said during the National Recovery Month, quote, "Addiction is personal to millions of families. It's personal to my family, and I know there's hope. Treatment works, recovery is possible, and my administration is here to support every person and every family on their journey to recovery." Close quotes. So thank you for your commitment to this monumental effort, and I look forward work together to reduce overdoses, save lives, and build the addiction infrastructure, and in doing so, making a real and lasting difference for the nation. Thank you. So I'm going to now introduce and invite Bishop Latrell Easterling to the podium to give the benediction. Welcome, Bishop.
To all those gathered here, especially Dr. Gupta, his family, Senator Manchin, bless you, for one whose area also includes West Virginia. I'm grateful for your service, and I'm grateful for what we know will come from Dr. Gupta and others who will continue to privilege lives and health above every other consideration. Thank you, Reverend Unger, also for your being here. Will you pray with me now, beloved? O God, our help in ages past, our hope for years to come, our shelter from the stormy blast, and our eternal home before the hills in order stood, or earth received her frame. From everlasting thou art God, to endless years the same. Humbly I ask thee, our Creator God, who made humankind in their image and called them very good, without hierarchies of human worth, who from New Delhi to Washington, D.C., desires that all people have the opportunity to live lives full of health and hope, to bless your servant, Dr. Rahul Gupta, as he assumes this historic mantle of servant leadership. As he prepares to serve in these unprecedented times, may he never become drunk with power given to favoritism, nor succumb to manipulative machinations. Bless and cover his partner in marriage, medicine, and life, Dr. Seema Gupta, and their beloved twins, Arka and Drew. Anoint Dr. Gupta as he brings the full measure of his training, knowledge, experience, and compassion to serve as our Director of National Drug Control Policy. Inspire him as he embraces the world as his patient, not just the world as it is, but the world you envisioned and ordained from the beginning of time. Instill within him the holy boldness necessary to transform lives and communities. Guide him with the call upon all humankind to love mercy, do justice, and walk humbly with our God. Support him with an administration that will continue to remember that addiction and abuse are born of hopelessness and despair. Surround him with a staff who will help and never hinder his mission. When the days are long and laborious, uphold him with your mighty right hand. When human avarice seeks to frustrate the democratic principles of our great nation, convict him with your omnipotent spirit of righteousness. When partisan politics forestalls policies that offer life, liberty, and the pursuit of happiness, remind him that the arc of the moral universe is long, but it always bends toward justice. When the wealth of this great nation is again directed toward the privileged and the powerful, give him evermore the vision, vigor, and voice to demand equity and equality. Dr. Gupta took an oath to do no harm, and now he has made a pledge to serve all the people, irrespective of party, place, or privilege. Give him the courage, give him the wisdom for the facing of this hour, There is no cause more noble than service, no greater honor than to care for the well-being of your beloved creation. And so now we depart. We depart to serve and never count the cost, to build a brighter tomorrow, to bring healing and hope to a broken world, to bear fruit that will last, and to offer agape love to all that we meet. And in the name of all that is holy, all those gathered say, Amen.
I heard the senator say, how do you follow up on that? I don't think, I don't think I can. Bishop, thank you so much. Thank you all. This concludes our celebration. Feel free to mingle, talk to each other. Thank you very much for being here today.